Welcome to I-SWAM Virtual 2021.
Okay, so before Dr. Hosung Choi start the presentation, I will read briefly his CV. So for Dr. Hosung Choi from South Korea, as education from March 1992 to February 1998, graduation of Yonsei Medical College from Seoul, Korea. And then work experience from July 2014 until present in Vienna Aesthetic Clinic, cosmetic surgeon as the chief director. Activities for Dr. Hosung Choi as a chief board member of Korean Aesthetic Surgery and Laser Society, as chief board member of Korean Academy of Facelifting and Contouring, as global key doctor of Merz Aesthetic for product Radius Belotero Ultra P, and then global key doctor of Sinclair Pharma, and then global training instructor of LG Chem, Y Solution, global training instructor of Pharma Research Product, Rejuran and Claviel, also as clinical training instructor of Exo Cobio. Okay. For everybody, all participants, if you want to give questions to Dr. Hosung Choi, you can write down in the question box and we will discuss after the presentation of Dr. Hosung Choi. Okay, for Dr. Hosung Choi, the time is yours.
Thank you. Hello, everyone. This is Dr. Hosung Choi. I'm a cosmetic surgeon from South Korea. Today, I'm going to talk about how to produce natural effect using various floating PDO threads. Let's start. For the past 10 years, I've been participating as a consultant and training instructor of various filler injection and thread lifting for all around the world. First of all, let's have a look at the classification of PDO thread, the basic classification. PDO thread can be divided into non-barbed and barbed type. And non-barbed type PDO thread can be divided into monofilaments and multi-thread type. And cog thread can be divided into various types of depending on the manufacturing method and the shape of the cog. Now in Korea, there are so many types of cog PDO thread, and they have all different shapes of cog or different in thickness of the thread. And also there are sharp needle and blunt cannula. You can choose one of them for the purpose of the treatment. According to a recent study, 90% of physicians are unhappy with the quality of thread, PDO thread used for thread lifting. It is due to an early breakage of the thread after the procedure, resulting in a rapid relapse or breaking easily in the process of storing the thread. However, Croquis, the thread product which is the topic of today, is the most fundamental and well-made PDO thread made by Samyang company. Samyang has been professionally researching and developing raw materials for PDO sutures since a long time ago. So about 80% of all PDO threads on the global market are made from raw materials supplied by Samyang. in 5-year stimulation test, the same conditions as the 15-day stimulation test at 90 degrees Celsius, Croquis tensile strength has remained almost unchanged, while other companies' products have significantly lost their tensile strength. And barb holding strength of Croquis from the same stimulation test also remained almost unchanged, unlike other products, regardless of the type of cork. As the results of this stress test show, Croquis has an excellent durability. Croquis' barb holding strength is well managed by a high quality assurance system from Samyang Company. As a result, Croquis has an outstanding durability. If properly stored in a room temperature, for example, the quality of Croquis will be maintained for more than 3 years. So in practice, I think I'm using many types of PDO threads from many other different companies. But usually when I keep the products for more than 6 months in my operation room, usually there is some early breakage of the thread. So sometimes I'm really embarrassed during the procedure. However, why I really trust Croquis products is because of its durability. It has a really different durability from other products. It has outstanding durability. So if you use this product and if you keep more than 1 year, for example, and you will see the same durability as the first time you purchase it. Let me introduce 2 representative products of Croquis. The first one is a screw type thread. It is a coil type PDO monofilament that is mainly used for the skin tightening. And the other one is barb cutting PDO thread, which is a floating type cork thread used to reposition the soft tissue. As I mentioned before, a Croquis cork thread has a strong tissue anchoring power that enables a secure tissue repositioning. It is connected to a sharp needle or cannula. You can choose depending on the purpose of your treatment. And it has a variety of thickness and length products. Now let's move on the insertion technique. There are the basic pattern design for each part of the face. The design for the mid and lower face, and for the upper face or brow lifting, including submental area and the jawline lifting. Let's find out the basic pattern design for mid and lower face lifting more in detail. At the point where the line A and B meet the hairline, which are the yellow points, there are entry points for lower and mid face. And thread insertion from these 2 entry points to lower and mid face can provide an effective lifting. Basically, it is not necessary to insert the threads beyond these lines C and D, because a sufficient lifting effect can be achieved even if the end of the thread is not located more medial or more lower than these 2 lines. Because if you put 2 medially, for example, from here to there, because this part, patients are moving their muscles always. So there may be some side effects, such as a protruding thread and unnatural smile. So it's better to advance your thread up to these two lines. An additional thread insertion from tragus to jowl fat pad is useful for more effective jowl lifting for older patients. And when using this vector, thread can be inserted beyond the vertical line. But I would recommend not to cross the Marriott line or melometal fold. So I think it's better to put threads up to or just in front of this line. Will be much safer. Reverse thread insertion technique is a method of inserting the thread in a direction opposite to the usual direction, from the lower part to upper part, or from the medial part to lateral part. This technique is useful when the basic method alone lacks lifting effects or providing a more definite lifting effect to the patient after a single treatment. So when you fail to achieve a good result by first session, if you want to do a touch-up or second session, then if you use this technique, you can be assured that the second session will provide a better effect. When combining these two methods at the same time, the usual direction and reverse direction, a much more powerful lifting effect could be achieved by enlarged skin surface for anchoring the tissue. However, a long downtime will be needed because there will be a little more swelling. Now let's have a look at a short video about the lower face lifting using various PDO threads. First, I checked the tissue mobility and asymmetry, and I should usually the routine is I draw two lines. They were line C and D, and I choose the area to be treated, to be lifted. And usually the entry points are made by these two lines and the crossing line with the hairline. And the upper entry point will be used for lifting for the lower face, and the lower one will be used for the mid-face lifting. And on one more entry point, just in front of tragus for the jowl lifting. And you can put more threads more in horizontal direction if the patient has a jawline distortion or a too definite, obvious Marriott line. But for younger patients, you only need to make 2 entry points. That's enough. And before inserting the thread, pinch the skin symmetrically. It's very important. And then if you penetrate the thread, the dermis, and then you should advance almost in 0 degree. That means very horizontally and almost parallel to the skin surface. And this area, usually there is a thick retaining ligament, which is zygomatico-cutaneous ligament. And when passing this ligament, you should advance your cannula a little lower than other pathway, because if the thread is located too superficially, then after lifting, this sunken may look worse. So to prevent the sunken of the lateral cheek, you may keep your cannula parallel to the skin surface. So where the skin is bulged, you advance a little shallower, and where there is a sunken area, you should advance the cannula a little bit lower, a little bit deeper. But do not penetrate or touch the SMAS. A severe bleeding may happen. And after removing the cannula, I usually tie 2 nuts using 2 threads. So before tying, put more threads as the design. The rule is not crossing the thread, not crossing this line, but a little crossing, I mean 1 or 2 centimeters crossing the line. It's okay, but do not advance too much. And once you put all the threads, if you lift the thread, then you will see the skin lifted very uniformly. And 2 of them, I'm tying 2 knots. You should tie very tightly, because if the knots are released after, the patients can touch the end of the thread on the entry point. And cut the remaining threads as close as skin possible. And after cutting, or after cutting the remaining thread, there could be some tension or dimple on the entry point, but it's very easy to release it, because you only have to pull the skin in the opposite direction from the thread inserted. And this is entry point in front of the tragus to lift the jowl. And there is a parotid gland, as we all know. So you should keep the thread very superficially. I mean, very close to the dermis. Don't go deeper. And when lifting the jowl, you can advance up to the fold, but do not cross the fold. And then tie again. This direction is very useful when lifting jowl, and there will be 2 vectors for jowl lifting, and eventually the jowl fat will be effectively lifted. Okay, I'm just pulling the skin gently, not too strongly. And this is temporal lifting to reinforce the lower face lifting, because for Asians, many Asians have already projected zygoma. So lifting only in the same direction or in the same area may cause some bulging or widening of the zygoma. So I prefer to use both technique, or sometimes I use only temporal lifting. For those who have already too widened cheekbone, or if this area is too thick, or there's too much fibrotic changes inside the skin, sometimes it's very difficult to advance the thread in the proper layer. Then I can use for the alternative treatment method. For this area, I do not tie basically, because you don't need to tie, because there may be some strong fixing points in the temporal fascia. So usually the lifting power or anchoring power is very strong. And it's better to use a shorter one than usual, around 60 millimeter length, and a little thinner, 20 or 30 PDO thread. I sometimes use only 3, but usually I put more than 5 or sometimes 10 PDO threads per side. And then there will be a strong grasping power of the temple, and eventually the low face will be well lifted. This is 1 month after. Actually, her sagging was not severe in the beginning, but I think the result is quite excellent. And now let's have a look at the eyebrow lift and mid-face contouring as a new strategy for lifting, thread lifting. I think these methods are a little advanced methods, but I will just introduce them. First, eyebrow lift. Before performing eyebrow lift, the vectors should be determined depending on the purpose of treatment or the expectation of the patient. The most commonly used method to determine correct vectors is to find the most efficient pulling point. Usually, the pulling point is located lateral part of the eyebrow, and you can check it by holding up the eyebrow with a fingertip, which is called Flowers maneuver. When lifting the forehead, inserting the thread downward from the hairline is difficult to sustain the effect for a long time. This is because the length of the thread being inserted is shorter because, of course, the length is only 6 to 7 centimeters from the hairline to eyebrow. And therefore, I would recommend to perform reverse insertion technique using thinner and shorter bi-directional cork thread and a sharp needle. If you are expert, you can use a sharp needle rather than blunt cannula because they can provide a more secure fixation because it can fix the thread into the periosteum around here. But there could be some bleeding and hematoma, and you can prevent it by injecting epinephrine before inserting the thread. Okay, this is a supraorbital anatomy. Usually the fat layer, the target fat layer is the subcutaneous fat layer. Looking at the cadaver dissection, the superficial fat compartments where the threads are inserted and pulled are usually this area, supraorbital compartment, and also temple compartment. So this part are usually the target fat layer. However, when roof is retroorbicularis oculi fat, which is a part of deep fat layer. So if this deep fat is pulled together, the eyebrow will be lifted more effectively. So if the cork thread is inserted in a reverse direction at the level of the eyebrow here, I prefer to make an entry point just beneath the eyebrow or lower margin of the eyebrow. And roof and subcutaneous fat layer together will be lifted, resulting in a more effective brow lift. So around the entry point, you should go a little deeper. And after passing the eyebrow, you should keep the cannula more superficially, I mean above the muscle, so or just beneath the dermis. And then when the full cannula is inserted, try to fix into the periosteum the end of the thread. Even if you use a blunt cannula, you can, at some degree, at certain degree, you can fix the thread into the periosteum. Maybe not the periosteum, maybe some into the fascia. Anyway, you can, if you can make more or less a strong fixing point, the lifting effect will be more effective and will last longer, this area. And it is similar to the movement of the body by this fitness equipment. If you know about this equipment, when we pull this handle, and you can go, your body will move up like in this direction. So this part will be the moving point, will be the eyebrow, and the fixing point will be the periosteum. So I'm explaining that why reverse insertion technique is useful when lifting eyebrows. So this is my technique. Entry points close to the lower lateral border of eyebrow here, 6 to sometimes 8, but I mostly use 5 to 6 threads. I usually use the Croquis with blunt cannula, 20 gauge cannula with 60 millimeter length. And I put, if I want more effective lifting results, I put an additional thread which are connected to sharp needle, 21 gauge 60 millimeters. But before inserting this sharp needle, you should always inject enough tumescent containing epinephrine. And after 15 minutes, there is only a minor bleeding. And to reinforce this lateral part lifting, lateral part of eyebrow lifting, I sometimes use temporal lifting, because temporal lifting can also help to lift mid and lower face together. And for older patients, usually the upper eyelid, there is some ptosis on the upper eyelid. So putting coiled monothread 203 just above the eyebrow, that will make a skin tightening of this area. And then this brow lifting effect will be reinforced by inserting this coiled monothreads. To achieve better results of eyebrow lifting, I often use botulinum toxin injection just beneath the lateral part of the eyebrow. I usually inject only 1 or 2 units for one side. Because this part, there is a upper lateral part of the orbicularis oculi muscle. So if you relax it, because this muscle usually acts as a eyebrow depressor. So if you relax this muscle, the eyebrow will be uplifted. And also, I usually use HIFU because it can correct the brow ptosis. And also, if the patient has an obvious temple hollow, then temple augmentation using filler injection will be also helpful to achieve more effective brow lift. Now let's move on the last part, mid-face contouring. As we all know, Oji curve is a kind of S-line that is on one of the criteria for checking cheek fullness, which is also useful as a tool for communicating with the patients. As shown in these pictures, Oji curve is more pronounced after improving mid-cheek fullness. The basic insertion depths of the cog, as I already mentioned during the video playing, please check before starting treatment if the patient has very thick and tight retained ligaments. So if sometimes there is already sunken cheek due to too tight retained ligaments, you should inform your patients about this presence of sunken cheek, because it may not be corrected after lifting, or sometimes it may look a little worse than before. So to prevent, to make worse of this sunken cheek, the thread should be located a little deeper. Parallel to the skin surface. So if you keep this rule, the result will be much better. And also, many young Asians have more pronounced lateral part of the cheek because of the high cheekbone. So this direction, I mean, using this vector may make a more widened cheekbone after the lifting. So you should be very careful not to use this direction. And if you treat patients who have a wide cheekbone, I would recommend to use more vertical direction. So to use this direction, it's quite difficult when you want to begin from the hairline. So I would rather recommend to use this thick anatomical structure. It's located 2 centimeters lateral to the lateral of the canthus. And put shorter bidirectional cork threads. And then if you tie them up at this area, you can create a very strong lifting effect without widening of the zygoma. So one will be passed more superficially and one can go deeper. This time I can advance my thread deeper than the smas. And then there will be an effect of the pinching, the smas, like this, after tying 2 knots. So maybe next time, if I have an opportunity to speak, I will select this topic for you. Since, okay, the medial thread, temporal lifting method, as I already mentioned, is another useful way to prevent the widening of cheekbones while providing effective lifting effect. So this part I will skip because I already mentioned. Depending on the age and facial skin condition and skeletal shape of this patient to be treated, you should be able to choose the most appropriate design for thread lifting. And also you should consider about the budget of the patient. And then more customized treatments results will be achieved eventually. I'll show you some before and after photo before wrapping up my lecture. Her mid and lower facial contour became more lifted and smoother after PDO thread insertion. And she was in her late 20s, quite young patient, but had less defined jawline. So I put some PDO cork threads in this direction. After jawline lifting, she has a well-defined jawline with the improvement of skin quality. And these are before and 1 month after photo. There is a noticeable eyebrow lifting result, and lateral canthus is obvious lifted as well. And even 3 months after treatment, the lifting effect of her eyebrows is well maintained, thanks to the reverse direction technique. And this lady had a thread lifting procedure based on a design like this. I put this in this direction for mid-facial lifting, and also I lifted her eyebrows. And after treatment, her facial contour has changed much more nicely, and her eyebrows and upper eyelids are well lifted. Therefore, for some cases, we should consider about additional lifting for the mid-face and lower face to achieve better brow lifting effect. So do not see only a part of the treatment. You should see the whole face, because you should keep the balance even after a focal treatment. So this is my conclusion. PDO thread plays an important role in contouring the face, and customized therapeutic approach is very important. And combined use of various types of PDO threads can facilitate more natural results. And use highly qualified PDO threads to provide a better predictability and longevity. Why combine use of multiple threads? While you can make only delicious food with good ingredients, you can prepare an excellent meal by combining good ingredients properly. So why not using various type of PDO threads together at the same time? Okay, that's it for my lecture today. Thank you for listening my presentation.
Okay. Thank you very much, Dr. Hosung Choi. What a nice presentation, what an amazing result. So after this, we can take a look at the question box. I'm still waiting for the participants. To all doctors, you can write down your questions in the question box, and I will read it, and then Dr. Hosung Choi will answer your questions. While we're waiting, I would like to ask about temple lifting, Dr. Hosung Choi.
Yes.
In your presentation, you give the temple lifting. If we do the temple lifting, maybe 3 or 5 pieces of thread, shall we do it together, doing also the thread towards the downward depth? Can we do it alone, or we have to combine it?
Of course, it's better to combine them because when we put the thread from here to there, the distance, the surface covering is quite small. But if you put a few more threads to this direction up to there, then the treatment result will be much better because you are using larger surface of the face. And also, as we all know that the bidirectional cork threads is not, frankly speaking, is not lifting, it's repositioning or pinching the skin. So if you put too much thread here, there may be a bulging in the middle. So if you put also the temporal lifting, then you will have some effect of sharing of pinching like this. So the result will be more natural, more effective and more natural by combining two methods.
Okay. What about the anesthesia before we do the temple lifting? Do we have to do tumescent, or what do we use for the anesthesia?
Actually, if you put the threads in a proper layer, which is subcutaneous layer, so it's quite superficial. But here, as we all know, that the superficial fat is quite thin or almost no superficial fat here. So during advancing the cannula, patient will be suffer from the pain by scratching the dermis. So I would recommend to put at least a small amount of tumescent, about 2 or 3 ml. It will be enough for one side before inserting the thread, especially for older patients because they have almost no fat. So the proper layer is very thin. So it's difficult to advance the cannula without any damaging to the tissue. And also there could be some bleeding and a little hematoma after inserting. So to prevent this hematoma, I recommend to put at least a small amount of tumescent before insertion.
Okay. Okay, thank you, Dr. Hosung Choi. And then now talking about the thread, what kind of thread do you suggest or do you recommend that we should use for, this one is floating thread, what kind of thread? Because some patients complaining about migration. So we have to prevent this happens. So please explain.
Yes, since floating threads are not fixed to some area, so it's floating as we already mentioned. So it has some limitation of the durability. So I think tying two threads on the entry point will make an artificial fixing point, and at least the migration will be much reduced. And also, if the thread is broken, the lower part can migrate to around the perioral area, so the thread can bulge the skin. So patient may complain about it. So this breakage of the thread you can prevent by putting more threads, or by using more high quality PDO threads. There are so many types of PDO threads, but most of them are not that strong. Especially when I keep these products more than 3 months, I should worried about the breakage during the insertion or after a few months of insertion. So if you want to be sure that the defect will last longer, then use high quality product like Croquis. So put more threads than usual, or select the high quality PDO threads. My answers.
Okay, thank you, Dr. Hosung Choi. Now we've got questions from the audience. The first question is from Dr. Maria. Doc, could you please show us how to examine the retaining zygoma ligaments? So examine the retaining ligament.
Okay, I'll show you using my face. So everyone has a zygomatic ligament here. Actually, some papers are demonstrating that the ligament is only a small part, but actually there are extensions. So medial extension and lateral extensions. So we can check it before starting the treatment. If you pull the skin in the lower part, downward, the skin will not move because of the strong ligaments. But I don't have an obvious sunken cheek, but some patients have very prominent sunken area, especially when you pull down the skin. And then you should show the sunken cheek by pulling the skin to your patient. And you should inform them about their presence of the sunken cheek, and you should inform that it's difficult to fix it completely, and sometimes it may look worse. So if you can, but I'll try my best, but sometimes it's difficult. So after informing about this side effect, then patient will be less complaining. Okay. And or if you see too tight ligaments, then I think choose another direction like temporal lifting, which will not cross these ligaments. So there's a alternative way to provide safer treatment.
Okay, Dr. Hosung Choi. Then, if we talk about sunken cheek, you mentioned that it's really difficult to do correction perfectly for the sunken cheek. Is it better if we choose a filler for patients with this kind of case? What do you think?
Yes, of course. Yeah, very good question. Because in practice, it's very difficult to reject the patient. So. Yes. I should find the best way to treat. So sometimes the first thing is I put a little more amount of tumescent, and during injecting tumescent, I a little dissect the ligaments. Of course, I cannot completely separate or cut the ligaments, but I try to make a little more room for
to release.
Yes, to release, and then I can more easily put the thread. Or if the sunken cheek is already present before treatment, I put some filler before. It should be before, prior to thread insertion, because after thread insertion, if you put cannula to inject filler, then the threads may lose the tension. So I inject the filler first, but less volume than usual, because I will lift this part and I will reposition at some degree. So I should feel about 70% only, because I'm not injecting only the filler. So I put first 50 to 70% of volume loss, and then I put the thread to reposition this part to fill the sunken area. And then the filler can act as a tumescent, and it can release the ligaments, and the thread will be more easily inserted.
Okay, okay. Thank you very much for your explanation.
You're welcome.
We've got another question. Now it's from Dr. Yanvi. Dr. Choi, I still don't understand about the tie, the knot technique. May I ask you to explain this more detail, please, Dr. Choi?
Okay. If you use too thick thread, like 10 or 00, it's very difficult to tie. So if you should use very thick thread, I would recommend not to tie them. But if you use thinner than 20 or 30, it becomes easier to tie them up. So whether using thick thread without tying, or using thinner and short threads with tying, it's up to you to choose. Anyway, to tie them up, you should use at least 20 thickness, thinner than 20,
Okay.
and then tie 2 times. Only 1 time usually it doesn't work. So 2 times of tie will be efficient, but 3 times, sometimes it makes too prominent knot.
Okay.
And sometimes patient can touch the knot underneath the skin. So I think 2 times is the best way. And also, it should tie very tightly. Do not tie very released.
Okay.
The tie should be very tight, and then after cutting, before cutting, you should pull the 2 threads. There will be probably some dimple here, because the thread are pulled too much.
Okay.
And after cutting, the skin will be pulled, and the knot position will be a little beyond the entry point. And these dimples will be released.
Okay. Yep. Dr. Choi, if there is dimple after the thread, do we have to give some a little bit massage, or we leave it just like that, and we will explain to patients that after a few days it will disappear? What about this?
Usually, there's no need to fix all small dimples on the treated area, but if there is a strong dimple, strong dimple means if you can see without moving, using expression muscles. If you see a prominent dimple, then it's better to release it before finishing the treatment. To release the dimple, usually I use keep the entry point. The pull the entry point. If you pull the entry point, you will see a more definite dimple. So where the skin where there is a dimple, you pull in the opposite direction, and then 1 or 2 cogs which have very high tension will be released. Or you can use your fingers and inside the oral cavity, and you push together, you pinch the skin and pull down. Then most dimple, even if there are 2 severe dimples, they will be released. But if there's a very, very small dimple and you can hardly see the dimple, only with the light, then I don't think it's necessary to release them, because they will be released anyway within 1 or 2 weeks.
Okay, thank you. Now, questions from Dr. Maria Angelina. Dr. Choi, you mentioned in class all of the technique these are for women. Now, what about for men if they want to get facelifting? Now, we're talking about men facelifting. Please explain, Dr. Choi.
Yes, of course, some men want to lift their face, but basically, men have thicker skin, and they have usually less sagging than women at the same in the same age. So I think more than 55% of thread lifting patients are women, but 3 to 5% are men. But among men, if patients have very thick skin and very little sagging only, then I don't use thread lifting. I recommend HIFU rather than thread lifting. But if patients have very thin skin and very old age, usually more than 60 in their age, they will have very thin skin, and the lifting effect will be more or less good. So I make a very strict indications when treating men. Not all men who want to be lifted using thread, I don't agree, but some of them are good indications. So it's very important to select the good patients, appropriate patients.
Yes. Okay. Thank you. Now we've got another questions now from Dr. Manalu. What is the difference between using thread with and without a reverse thread? Will the reverse thread extend the effect? Could you please explain about this?
Can you repeat one more time?
So this question is about reverse thread. So your technique, you mentioned about reverse thread. Is this technique with reverse thread can extend the effect of thread for lifting effect? Could you please explain this?
Yes, of course. Because I don't want to recommend to use only the reverse thread, because reverse thread technique, insertion technique, is a supportive technique. So first, we should lift for the basic pattern design, and after that, for those who are not expected to have a good result, I always put into the reverse direction. So reverse direction technique is very powerful lifting effect, but it's always a supportive method. It should not perform alone. So that's the important point. And also, when we do reverse insertion technique, it's usually provides not only better effect, but also more longer lasting effect. That's why it's very useful.
Okay, thank you. Now we've got question from Dr. Ubeta. Why don't you use a long anchorage thread that she means 40 centimeters with temporal 40 millimeters maybe, with temporal fascia as the anchoring point to lift?
Yes, I sometimes use, but in the past, I used to use a lot because it can provide a really strong effect, and it lasts quite long. But side effects are also frequent. Most patients are complaining about the pain, the prolonged pain in the temporal area, because the fascia is stuck with the thread. Okay. So the more we put the tension, the more patient will suffer from the pain. So these days, most patients want a very short downtime. And even if they should get treatment every 6 months or at least 1 year, they prefer to get safer and treatment with low downtime. This is the Korean trend, maybe. Anyway, so these days I use a more simpler method, and method with causing less problem and less discomfort. So this is the Korean trend, or maybe this is the world trend. But sometimes if the patients are very old, and sometimes a patient need surgical facelift, then I try to put longer PDO threads starting from the temporal fascia.
Okay. Dr. Choi, is that means that if we use the technique of reverse thread, this might give more comfortable for the patient after the thread insertion if we compare with using the anchorage thread? Is that right?
I think not really, because in the aspect of comfort, patient will have more discomfort when using both threads. Of course, because the thread insertion plane are larger than only this direction. So patient will feel a little pain around here, but I think the result itself is really natural. And patients are usually they want more natural results and also effective results, and then they can ignore some discomfort. So they usually want more effective and more natural results. So that's why I use reverse insertion technique.
Okay, one more question. This is maybe for the last question. Now, you mentioned about the brow lift that we put some thread at the lateral part of the eyebrow. Could you please explain once again about the technique? Where is the insertion point? You mentioned in your presentations at the brow, and then up to where is the insertion point?
Okay, the insertion point is first just the the lower margin of the lateral eyebrow. So usually the eyebrow thickness is around 2 centimeters, or sometimes thicker than 2 centimeters. But anyway, so the lower part is here, and from the mid-pupillary line, I usually put the lateral part from the mid-pupillary line. So if you make 0.5 centimeters between two thread entry points, then you can put around 6 thread until the tail of the eyebrow. So insert the thread from the lower margin of the eyebrow. And first you go a little deeper, but I don't mean you touch the bone, but if you pinch the eyebrow, you can go a little deeper in the beginning. And after crossing the eyebrow, then you should advance your cannula much more superficially, just beneath the dermis. And as this is convex area, so it's very difficult to advance easily, softly. So you should bend the cannula. The cannula can be bended. So using the other hand, you push the tip of the cannula not to penetrate the dermis. So you should go up to the hairline a little more, cross the hairline, and then your cannula will be stuck at the end. So there is a fixing point.
Okay. Okay. So the end of the thread is above the hairline.
Yes, that's right.
Okay. So if we do the brow lift, how long will it last? The lifting effect for brow, how long will it last?
Using more than 20 threads, using the reverse direction technique, I think it can last up to 1 year, but maybe in between 6 months and 1 year, around 8 months to 10 months.
Okay.
It's quite excellent longevity, because usually when we put like this, I can expect only 2 or 3 months.
Okay. Thank you very much, Dr. Hosung Choi. We've got a lot of discussion about that, and this is very interesting. Thanks again. For the closing, could you please give some take-home message for all the doctors, for all the participants, please?
Yes, I think thread insertion is one of the most challenging and very interesting treatment modality. And I think in the future, the thread insertion technique will be more advanced. So If there is a chance of speaking in this meeting, I will prepare a more interesting and advanced contents. And also, I really hope this pandemic will end soon, and then we can meet offline.
Yes, thank you very much. Yeah.
Stay healthy and stay safe.
Yeah, you too, Dr. Hosung Choi. Thank you very much. Success always for Dr. Hosung Choi. Stay safe and stay healthy. To all participants, thank you. This is the end of Dr. Hosung Choi, but we will still have another speaker after this. So stay tuned in a virtual I-SWAM. We'll meet you after this. Okay. Thank you, Dr. Hosung.
Thank you. Bye-bye.
Bye.